thank you very much for joining today. This is Helping Rare Families Manage Medical Trauma, brought to you by Angel Aid. We're featuring Melissa Hogan, co-author of Afraid of the Doctor. And my name's Crystal O'Loughlin. I'm the founder and CEO of Angel Aid. We provide mental health and wellness services for rare families. And I am so honored and excited to present with Melissa today. She is our featured practitioner. This is going to be such a treat for you. Melissa is a medical trauma coach. She is an author and she is a rare mother. So she has practical experience as well as professional experience in this area. She's co-author of a book called Afraid of the Doctor, Every Parent's Guide to Preventing and Managing Medical Trauma. She's a healthcare attorney. She's founded a nonprofit. She's raised millions of dollars through research, and it's through that work that we actually know each other. And she's been an invited speaker for the Food and Drug Administration, for the National Institute of Health. She's founded a nonprofit and industry presentations at various different conferences. She's taught graduate and law school. She is a published peer-reviewed author for various different kinds of research studies. She's appeared on The Doctors and Inside the NBA. I mean, we have a celebrity not only inside rare disease, but outside rare disease as well. And we're just so honored that you're lending your expertise and your perspective to us today. So thank you very much, Melissa. So I just wanted to take a moment and share a little bit about Angel Aid and why we're bringing this webinar to you today. You know, collectively, as a society, as a human race, we have been experiencing suffering, various different degrees of suffering within this pandemic experience. And there's such an opportunity in that experience of suffering to find relatability with other human beings. And so that's what we really want to talk about today, is the role of your opportunity and our opportunity to relate with other individuals. Angel Aid is all about personal connection and emotional support for rare families, fostering that empathy, fostering that relatability and that connectedness. And in particular, we have a sweet spot, a special spot in our heart for rare mothers, who are the primary caregiver in 82% of rare families. Never an exclusion of fathers or any other members of the family. We just feel that mothers are a wonderful entry point into a mental health and wellness conversation within the family. So we want all of you to experience compassion and relief through this webinar today. And we have lofty goals for how we're going to be scaling our community. The way that we bring relief in Angel Aid is through storytelling, sharing that experience that our rare families are living through, and providing guidance and permission and encouragement and practices of self-care, and doing that in a connective global environment. We record just about everything that we do so that it's available after hours, because that's often when caregivers have time to take a look at some of the offerings that we have. So we have a vast YouTube library, which we encourage you to visit. And we have weekly and monthly support groups. So these are all about virtually coming together, but grounding into the heart-based experience. We also run a series of patient programs. We've got a program for cystinosis patients coming up, young adults specifically. So keep an eye on our events page and our programs page for future offerings. And one of those offerings was developed about 3 years ago. It's specifically around a pain point in families. Families told us about needle pokes. So blood draws, injections, IVs, were just creating so much chronic stress within the family. And so we developed in partnership with a practitioner, a 7-step program that is offered through a webinar. We have downloadable plans that you can use within the family. And then we have a wellness kit that includes products as part of that training. And even with the needle pokes training, what we realized is that we need to pull the lens back and look at the bigger topic of medical trauma. And then voila, Melissa came into our life. I've known her for quite some time, but she went and published this amazing book called Afraid of the Doctor. And so we had a conversation about collaborating. Melissa agreed to offer her perspective in service to our rare community. And we're just so grateful for this time today. So I'm going to stop sharing and turn it over to Melissa to go ahead and present in our webinar today. Oh, you're on mute.
There we go. Thank you so much, Crystal. I'm going to go ahead and share my screen here. There we go. All right, so I want to thank everybody for joining Helping Rare Families Manage Medical Trauma. As Crystal said, my name is Melissa Hogan, and I'll be your host, and I will say I'll be your coach, if you will, today, and we'll talk some more about that. So first, obviously, I want to thank Angel Aid and Crystal for reaching out to me and for putting this together and for inviting all of you and promoting it. I think and hope that this will be personally beneficial to you and especially to your child as well. So I'm going to talk and share for 35, 40 minutes, and then we're set to have about 10 minutes of questions. So if you think of questions along the way, be sure to jot those down. And speaking of that, if you don't have it already, grab a pen and some paper because we're going to have some exercises throughout the program. So let's go ahead and get started. So as Crystal said, my name is Melissa Hogan, and most importantly, I'm the mom to 3 boys who are now teenagers, actually. My youngest son, Case, is now 15, and he has MPS II, or Hunter syndrome, which is a rare genetic disorder. I also have 2 boys who are 16 and 17. So you can imagine my household with a 1, 2, and a 3-year-old. It was a little crazy for a long time. And then Case was diagnosed when he was only 2. So it's been quite a journey, and it still is quite a journey, as I'm sure a lot of you have as well. Professionally, I've been a healthcare attorney for over 20 years, and that has come in handy as eventually I was part of founding Project Alive, which is a Hunter syndrome research and advocacy foundation. And we've gotten to do some really cool things about when we are bringing awareness to Hunter syndrome in the community. Like Crystal said, we were on The Doctors. Case's favorite was to be on Inside the NBA. He's a basketball fan, and he got to meet Shaq and Charles Barkley. And so my hope and my desire is in a similar way that we were able to bring awareness about Hunter syndrome, to really bring more awareness to the problem of medical trauma and anxiety and strategies to help families deal with that. Because what I really found is that this affects lots and lots of people. You know, at the beginning you see and you think it's you, and then you start to see more and more people that are having issues with that. And I started writing about this topic in 2011. And I started getting more and more questions from other people in our Hunter syndrome community and the rare community, the special needs community. And I realized, a lot of people are dealing with this. So eventually last year, I published Afraid of the Doctor with one of the leading pediatric psychologists who specializes in medical trauma. So we were able to bring a parent and our, experience in the trenches, if you will, and a professional experience to that to try to help families. So here's where I'll offer the important disclaimer that I'm not a therapist. So this is not medical advice, but there's a lot more resources in the book. We'll have some resources at the end of the presentation as well that you can dive deeper. This is really a flyover to give you a place to start. So, like I said, I started writing about medical trauma in 2011. And you might be like, well, what is so significant about that year? Well, that was the year where my son had been diagnosed in 2009, and he had lots of doctors, and he had a weekly infusion. And then he got into a clinical trial. And so, about 6 months into that, he was just kicking and screaming, and it actually required multiple people to hold him down in order to get his care. So, it actually started impeding his ability to get medical care that he needed. So I started researching, talking to experts, and figured, there's got to be a way that's better than what we're doing. So as we talk more, you'll see that while having medical trauma and anxiety is more common, the more interaction you have with the medical system, it actually can come from even just one scary incident. And it's not limited to kids with chronic conditions. It can happen in typical children. As well. So in the book, In Afraid of the Doctor, we actually weave in 4 stories of families throughout the book and adapt the strategies and really talk about how to use them in the moment and how to plan ahead and use them as well. So, for me, medical trauma is so important, and why I think it should be important to you and to providers and to industry is it really affects mental health. And we've been talking a lot more, thankfully, about mental health in the pandemic, but it affects our children's mental health and ours. And it also can bleed into other areas of our life, into our daily functioning. And that's when it's really a problem. It can affect our relationships. So between us and our children and providers and other people in our family. And then, like I said, it can actually prevent seeking or obtaining the medical care that we need. So that makes it such an important issue to me and to you. So when I was looking at preparing for this session, I debated, do we talk about medical trauma as it affects caregivers or as it affects our children or both? And we're really going to do both, but we're going to start with the caregiver because our mental health really affects and permeates everything related to our children as well. And remember, like I said, this is a flyover, so there's so much more to learn and in the way of strategies for parents and for children, and even for healthcare providers. So let's start by grabbing your pen and paper and divide your paper in half by making 2 columns and label one me and label one my child. So as we go through the session today, listen for me and I'll prompt you to make notes in one or both of the columns. So I want to start from the perspective that we are all on a journey. Of course, we talk about our life's journey, but we're all actually on a medical journey as well. And I elaborate more about this in the book. You have your own medical journey. Your child has a journey. And then you have a journey together with you as their primary caregivers, who I'm expecting many of the people on today. Does that make sense? There's overlapping perspectives, but for you personally, the things that you have experienced, they don't affect you in a vacuum. Whether it's your medical experiences as a child, surgeries maybe that you've had, or procedures, even as an adult. And then your experience as a caregiver, it's all part of your medical journey. And then that overlaps also with your child's journey. And then obviously that might overlap with other adults that are in their life as well. And so some of this information, you might think, oh, that's not really helpful right now, but take what you will from today that might be helpful for you where you are right now, given your past experiences. So let's look at your paper. And in the columns for you and for your child, start by writing down at least one medical event or experience that you expect to have in the near future. So whether that's an appointment or a surgery. So write down one for yourself and one for your child, and keep those in mind as we walk through the things today and how the strategies you're learning might apply to those specific experiences. So, first, let's talk for a few minutes about what exactly is medical trauma, and then also what might be confused with medical trauma. So, here are a lot of big words that are different ways of really saying the same thing. Some people say medical PTSD, medical traumatic stress symptoms, but we coined the term and are using the term medical trauma because that just summarizes everything. And medical anxiety, when I say that, that can be several things. So that can be a precursor, so something leading up to developing that trauma. It can be a symptom of the trauma that you have that anxiety, or it can be a standalone, somewhat milder version that never develops into full blown medical trauma. But these strategies that we're going to talk about help whether it's medical anxiety, full blown medical trauma. So we're just going to use that as a shorthand. So here is really the technical formal definition for medical trauma, especially in children: a set of psychological and physiological responses of children and their families to pain, injury, serious illness, medical procedures, and invasive or frightening treatment experiences. But this is really what it is. It's emotional and actually physical reactions to scary medical stuff. When I say physical, it's more appropriately, like I said earlier, physiological. So it's deviations from the normal, healthy functioning. So think of that quickening breath, that tension. And we're going to talk a little bit more about that as we get into some of the symptoms. So, who is likely to develop medical trauma? So surprisingly, it doesn't matter if someone has a condition that is technically severe or rare or chronic, like I'm sure a lot of the people in this room or our children have. Really, anyone going through medical treatment can develop medical trauma, even when the appointments are not necessarily something scary, but it's how that person experiences those events, and which then draws back to their experiences prior to coming there. So it can happen through vaccinations, but here are the factors that make it more common. If they've had other traumatic events, females are more likely to experience medical trauma. If they use certain types of unhealthy coping, like avoidance, and then also the more of the tough, frightening experiences that a person or a child has, the more likely they are to develop medical trauma. But it can happen after one event as well, like I said. So there was a study many years ago that many of you may have heard of called the ACEs study. And that's the Adverse Childhood Experiences Study. And it looked at the items that could be potential for developing trauma. And it varied from things like divorce to different types of abuse and neglect, poverty, violence, and illness. So, for example, someone who has a high ACEs score, who has the likelihood of other traumatic events, would then also be more likely to possibly experience medical trauma. So, in your columns, think about these things and consider whether these might apply to you or your child, and jot down any notes that you might want to remember later. So sometimes it's hard to know whether something is a symptom of medical trauma or other trauma, or versus one of these other problems. So, for example, behavior problems, they could be related to medical trauma, or they could possibly be related to your child's actual medical condition. Some of the rare genetic disorders, such as Hunter syndrome that affects my son, have behavioral problems as part of the disorder, or autism spectrum disorder. So, or it could be pain or something else. So, similarly, we as adults, we can experience mental or physical health challenges related to genetic predisposition, situations in our life, abuse or other trauma. So looking at, the things listed here, you need to ask yourself a few questions if you're seeing possible symptoms of medical trauma. Ask yourself, when did it develop? Is it common in you or your family? Is it common to other health conditions that you or your child may suffer from? Is it something that happens when your child or you normally experience pain? So that could be the cause. And then also to consider other traumas and stress to try to look at and see, is this really medical trauma or is this, something else? So this is one of my favorite quotes when talking about trauma. Trauma creates change you don't choose, and healing is about creating change that you do choose. It emphasizes that we can't always control, or usually can't control, the events that cause trauma in our life. That's often why they're so traumatic, is a lack of control. But healing is an intentional choice. And so I want to thank you for being here today, because this is a part of choosing a path toward prevention and healing any medical trauma that might exist in you or your child or might develop later. So let's focus for a bit on medical trauma in ourselves as caregivers. A recent study highlighted some additional risk factors for medical trauma in caregivers. So, more medical interaction, which we've talked about before, including more and longer hospitalizations, number of appointments, so higher number of appointments. Minority status was also linked to a higher likelihood of developing medical trauma in caregivers. This particularly was a study of burn victims, and in that study, parents of Asian descent specifically had the highest medical traumatic stress scores. Also, the level of impairment of the child's quality of life. So, how much their injury impaired their quality of life affected the likelihood that the parent would develop medical trauma. So, switching gears a little bit, one of the things that I researched and wrote about in the book is identity. And you might say, well, what does identity have to do with medical trauma? And I promise it does. One of the things that I really love about Angel Aid is that it speaks really openly about self-care and the need for support for caregivers internally and then your support system. So really understanding the role that caregiving plays in our life and how, if we're not careful, our entire identity can be subsumed within that role of caregiving for our child. It's so important to focus on the fact that, we are that person in the middle of the circle here. That is us as an individual. And if we're not careful, all of these other roles or identities that we play in our life, when we become a parent and then a caregiver, if our child is medically involved, we need to lead their medical team. And then, as I'll talk about, being a coach related to medical trauma, but really going back to making sure we preserve what is in that personal identity of us is so important in being able to help our child. And also, one of the other things to keep in mind is that the child's stress responses are strongly linked to the parental response, because children look to parents. They look to us for reaction guidance. So, how should I react to this? And they can model it after our reactions. They look to us for coping strategies. What are ways that we've learned to cope? And they learn those from us. And then ways to regulate our emotions. What are the strategies we use to regulate how we respond to things? So that's part of why I started with caregivers, is because we become so important to our children and how they respond. So let's move to looking at symptoms of medical trauma. So here are the general categories of medical trauma symptoms. And we're going to look at it, like I said, and start with caregivers. So changes in overall mood. Again, people can have anxiety and depression separate from medical trauma, but then it can also be rolled into this. Re-experiencing, if you're playing things over and over in your mind or talking about the same things, triggers, avoidance, refusing to talk about your child's condition or appointments, we're going to drill a little deeper into an aspect of hyperarousal, which is fight, flight, or freeze. So look at this list and start by jotting down some examples in your columns for you that you might be experiencing right now or that you might have experienced in the past. So just take a minute and see if any of these make sense to you and sound familiar, and jot those down. While I talk to you a little bit more about fight, flight, or freeze. So one of the most common responses in trauma, in any kind of trauma really, is the fight, flight, or freeze response. It used to be just fight or flight, and now we have freeze. And in abuse context, they also talk about fawn as well. But we're going to focus on these. So a fight response, I'm going to give some examples of each of these for a caregiver and then also children also. Fight can include, crying, clenching your fists or your jaw, yelling, arguing with the doctors. Hopefully not a lot of us are doing that. Or, the kids arguing, the kids becoming physically aggressive with medical providers, like kicking, hiding, hitting, or biting. So flight responses, it's not just fleeing the room. It can include things like refusing to look at providers, trying to leave as quickly as possible, trying to wiggle away, not wanting to engage at all as a flight response. And then here's some examples of freeze responses. It can be including like holding your breath, zoning out, watching everyone really closely without communicating. Someone who is freezing may not be able to answer questions or tell others what they need. We may, for example, not be able to say, hey, I'm feeling really anxious, or I'm in pain, or I don't understand what's happening. That can be a freeze response as well. So see if any of these sound familiar. And again, jot them down in your notes. Another aspect of the trauma response are triggers. And that is something that takes you back to a situation, like that. Not necessarily visually, but emotionally. So for a lot of people, diagnosis day is a big trigger. They start replaying things in their mind, and that's a trauma response. Certain places where things happened, or even certain people, even if it's not negative, it can take you back. A smell that you smell in the hospital every week, or certain sounds, certain songs that we're playing. So think about what triggers you may have experienced and jot those down, and what emotions or experiences do they bring you back to. So think about those and make some notes. So here is an overarching list of some examples of the strategies I write about. They're useful for preventing and reducing medical trauma. So we give lots of examples in the book about how to use these and implement them in different situations. But today, since we only have 40 minutes, we're going to walk through a couple examples in the context of caregivers, and then a couple examples in the context of children as well. So first, let's talk about adapting the environment. Our senses are so amazing, and they're so important because they communicate to us safety or danger. They communicate joy or sadness. They communicate stress or calm. So what we do to affect our senses really helps manage our emotions. So let's do an exercise. Think about the last time you walked into the hospital or some other stressful medical encounter. Jot down, what did you hear? What did you see when you walked in there? What were you touching? What did you feel? What were you tasting, if anything, or while you were there? And then what did you smell? So I'm going to talk about some different examples, and then we'll revisit what you've jotted down for that. So as far as hearing goes, for our children or for us, the voices we hear, are we hearing any laughter? Laughter can affect and reduce trauma response. Singing, if maybe you mask hospital noise with a sound machine or white noise, or put on headphones with your favorite music. Sight, are there posters? Are there pictures in the hospital or other place you're going that make you happy? Is there natural light? So natural light actually has been shown to lower perceived stress, pain, and actually lower the pain medication that patients request. Similarly, nature also lowers stress, pain, and creates a higher pain tolerance. Um, so let's move to touch. One way that touch can be helpful are things such as a weighted blanket for parents and children, and hugging, holding hands, stroking, also animal interactions. It's been shown that if you have an animal in your life, if you have a pet, it actually can improve your reaction as well. So, taste, favorite drinks and snacks, chewy foods, chewing gum, uh, moving to smell, lotions that make you feel better, or your child's favorite lotion, aromatherapy, if that's calming for you, personal items that smell like home. That can be part of adapting your environment. So going back to your notes, when you wrote down what the senses were at the place you went to, did each of those things make you feel good? Put a plus sign if it made you feel good. If it made you feel anxious, put a negative sign. Or were they just neutral? So think about the ones that were negative. Is there something you can do to counteract that? And then can you add more positives in there for the senses to help adapt that environment to make it less traumatic for you? Let's move to another strategy we can use, and that is timing. It may seem simple, but timing can often improve a medical experience that might otherwise cause extreme anxiety or trauma. So, when you make appointments, for example, do you just take the time and date that they give you? Do you just think about it in terms of, well, am I open? Does it work with my schedule? Or do you go deeper into the timing, thinking about the time of year, the time of day? Do you need to anticipate it? Or avoid anticipating it and get it done first thing in the morning and not have to worry about it in the afternoon? How does it affect other people? One of the things with timing is also considering margin. Can you put a buffer amount of time before and after to really implement, even a short amount of time, some strategies that help reduce the anxiety and trauma? So I say here there is bad timing, there is better timing, and best timing. So bad is like everything's bad. You're rushed. You got to get out of there, quicker, and everybody's having a meltdown. Better timing is starting to implement some things that provide some of that buffer and being more strategic in how you think about the timing. The best, again, it doesn't have to be perfect, but it's where you plan ahead and you think about implementing things and having that margin in order to deal with any possible meltdowns. So it really does take some planning. And so, we can implement a lot of these over time to do better. So here's another strategy that we talk about in the book called body control. And here's several examples. And we actually have in the book actual scripts that you can use, and several examples of how to do each of these. But we're going to just do one really quickly today called diaphragmatic breathing. So put your hand on your lower abdomen. That's, you want to breathe through there, through your diaphragm. So let's all sit. Hopefully you're sitting, and put our feet flat on the floor and close your eyes. So take a second, close your eyes. We're going to inhale for 4 seconds, hold for 4, exhale for 5, and then hold for 4. So inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, 5, hold, 2, 3, 4. So doing that even for a couple minutes can help calm our bodies from anxiety and stress that we're experiencing. Progressive muscle relaxation is another great thing to do. It's better lying on the floor, and you just clench you start with your feet and you clench them and then release them and you move up your body. Um, and that really can calm, especially if you're in a very anxious state. And visualization, like I said, we have some scripts in the book that talk about what you can do to really calm yourself and take yourself back to a calmer place, especially like if you're in a hospital or if you're in an appointment where you're suddenly getting very anxious. So, those are some of the examples that, I wanted to go through in dealing with medical trauma and anxiety in caregivers. So now we're going to shift to talk about in our children, because a lot of you expressed that that's really where you're most concerned at this point. So, the techniques are actually applicable across the board. Can be used in us as adults and in children as well. There's just adaptations for each of us. So here's the general categories again of medical trauma symptoms. And you'll see the examples are a little bit different that I put here. So again, jot down in your columns if you've seen some of these in your child, and you can go back to those and think about the strategies. So for kids, you see here, they might repeatedly talk about things. They might refuse to go in the doctor's office, refuse to get in the car, get upset when people are talking about medical things. So some of the same things, but a little bit different, obviously, in children. So when I spoke about identity earlier, I gave you and I the title of medical trauma coach. And that comes from an acronym that Dr. Marsack and I developed to help evaluate how to support your child using these strategies. So it applies to your own self-care and medical care as well as for your child. The C stands for collect information. O is for observe the situation. A is for ask questions. And that means asking yourself questions, asking your child, asking the providers. C is choose the strategies that are you're going to start with or might be most helpful given your circumstances. And H is use those to help your child. So we give a lot of examples in the book of how to apply this to lots of different situations and to the stories in the book, and obviously more techniques than what we have time to describe here today. So here's just a recap of the strategies that we talk about in the book. We went through a couple of these for us as caregivers, and now we're going to go through a couple more, talk about them in the context of children. So desensitization. If you've ever gotten allergy shots, for example, you're going to understand what I'm talking about here. So exposure in small amounts, allowing them to slowly and calmly master their fear. So just like allergy shots, take a tiny bit of whatever that allergen is and introduce it into your body to stimulate a smaller response to slowly get you used to it. That's what this strategy is as well. So that's my cute son there as a young child, actually somewhat excited to be at an appointment. We use this strategy a lot. You might be unknowingly already using it, or you might be doing the opposite, which is avoidance. So for example, let's say you drive the same route to the hospital all the time, and you realize that, you know what, my child's getting really stressed out driving to the hospital. And you're like, oh, I shouldn't drive that route anymore. Or I shouldn't take that way to the grocery store. And so you start avoiding that because you don't, for good reasons. You don't want to see your child get upset or stressed. But that actually is the opposite of the technique of desensitization. So the object here is to normalize and integrate the things that are causing stress. So for an example in that context would be, if you drive to the hospital the same route, driving that route but not going to the hospital, driving that route to get ice cream or something else, and then sometimes you're driving it to go to the hospital. Or let's say it's the hospital itself that really causes your child to start to have a stress response. Start introducing doing that in other contexts. So going to visit other people at the hospital, bringing gifts to the medical providers. So ways that you can normalize it and so that it can de-link it for your child from that stress response and that fear and integrate it into their life. Another aspect of this is muscle memory. So if your child has certain movements that they have to do typically for appointments, one example is if they have a porta-calf. So some children get so traumatized that they don't want to lift their shirt to see the port. They don't want you to touch it, or if they have to lift their arm, they don't ever want to do that. And so it's learning to do those motions in a context that does not relate to the trauma that they may have experienced. So it's, touching that port area when you're giving them a bath or doing something else where you're not getting ready to access it. It's moving that arm up because you're dancing around the kitchen and not getting ready to access that port. So that's a way to consider muscle memory. One of my favorite techniques that we actually used a lot is medical play. And I love this quote by Mr. Rogers, of course. Play gives children a chance to practice what they're learning. So they're learning through play all the time. So for medical play, you might think, well, it's just normal play, but it's actually can be very focused. So you can get the supplies. If there's procedures that your children or that your child has typically or regularly, like an infusion, or if they have an appointment coming up that might be more stressful, you can get some either play supplies or actual, considered safe parts of the supplies to have at your house. And you can do that by using the coach framework. You can collect information about what's needed there. You can observe if you do that procedure or see that procedure a lot. Ask questions of the people involved. What objects might be helpful to practice or get my child used to this. And one part of that also is to develop a common language. So our children, we see them develop language from when they're young, and sometimes they call things these strange names, right? So it's not necessarily important that the words are the actual thing, that the object or the room or the procedure. It's really how they understand and take it in. So listening to our children and, what words are they using to describe certain things? So for example, my child called a port access needle a 1, 2, 3 because the nurse would say 1, 2, 3 every time before she accessed. So we just called it that. So learning and to discern what that common language is developed with your child. And then there's a process to start from letting them have some freedom with those objects or those play medical supplies, and then maybe starting to direct them a little bit like, oh, does your bear need a shot today? And then moving to the point where you can actually play together, and hopefully once you've moved through that, your child can actually be doing some of these things themselves, and maybe walk into the hospital and tell the nurse, well, I'm going to take your blood pressure, when formerly that was something that really caused them a lot of anxiety and stress. So again, that's one of my favorite techniques to use. And so that's the one that I got excited about and wanted to end the program with. But before that, I'm going to provide some additional resources. So here's some resources that are on the web, some additional books. And like I said, we talk more in the book about, how to access things like social workers and child life specialists that can really support you and your child even more. So if you feel like you need additional support, seek out a professional, check out these resources and the book, and that might be able to help get you started. So at this point, I think we're going to move to any questions. And I think Crystal's going to come on and check out and see if we have some questions in the chat that we can talk about.
Oh my gosh, Melissa, thank you so much. That was just really wonderful. And yes, we do have some questions. So we'd like to invite you to submit your questions via the Q&A chat box. And here's the first question. So when we get out of the hospital for my child, it takes me like a week to recover and get back to being myself, from all the anxiety and, being, sort of the lead all the time. What could I do to make that better?
That's a really good question. And that is a common challenge. Um, so, one of the things and one of the strategies we didn't go over, and it seems obvious, but planning ahead. So, realizing that the first step is realizing, hey, this is the response that I have, and it's really difficult. Share that with some of your support system and say how can we make this better next time, and ask for some support uh, for the next time. If it's a planned hospital stay, obviously it's a little bit easier, but if it's unexpected, knowing that person that you can call to give you space after you get out of the hospital and give you support. Another part of that is trying to identify what is it that makes you anxious. Are there certain things that are happening in the hospital that you can use some of the strategies to reduce the anxiety, or is it the overall experience? So you might be able to target specific things. But in addition, one of the strategies we didn't talk about was a reward system. And I
Mm.
know we think about that typically for our kids, we're going to reward this behavior, but you know what? As adults, we need rewards too, and especially in the sense of relaxation. So when you've been able to put some of that support system in place for getting out of the hospital, knowing that you have some type of reward, whether it's in the form of just being able to go sit by yourself in the park and read a book, all the way to, we'd love to all be able to go get a massage as soon as we get out of the hospital, but that's not feasible for a lot of us. But finding that thing that you can reward yourself with, so you have that coming and be able to de-escalate that anxiety afterwards.
Okay, fantastic. Thank you. One of the questions that's come through has to do with teenagers. So specifically, do you have any recommendations for teens that deal with medical trauma in that subpopulation?
Well, the great thing about teens is, if they're teens, there's typically developing, and then we actually in the book have a whole section on special populations. So, if they're cognitively impaired or nonverbal or young children. So depending on if you're talking about a typically neurodevelopmental teen or cognitively impaired, there can be different strategies. But in the typical sense, the great thing is they're going to be able to understand if you talk to them about what might be happening to them, and understand actual things that they can do to help undermine that. So using the coach strategy to really sit down with them and be frank and say, hey, I can see that this causes you anxiety to deal with XYZ aspects of this treatment. And recognizing that is really often the first step, and saying, here's some things that I'm learning. So for example, if you have the book and you can go through and say, here's some relaxation strategies, can we work on these together? And one of the stories we weave through the book is a teen who, a typically developing teen who has an injury. And so it gives some examples of how to sit down with them and walk through things like the body control techniques, or, journaling, and, obviously medical play wouldn't apply really to a teenager in that sense, but there are definitely things, and reward systems do work for teens, but being aware and being open to talking about it is really helpful too.
Yeah. Thank you. Thank you. And we hear from a lot of the nurse practitioners that we work with, as well as child life specialists, to try to find rewards that are non-sugary snacks. So sometimes there's a need to go in that route, but there's a reason why stickers are often handed out at dental offices and things like that. So try to find something, maybe a special song, or a sticker, or some sort of special dance move, depending on the age.
Yeah, we actually, reward systems are great. We, at every clinical trial trip that my son went to for many years, I would have a whole reward system for each aspect of the appointments. And so often they were a theme. So one theme was Toy Story. So they were little Toy Story figurines and, just went through different things each time. So really, again, that planning ahead becomes so important.
Yeah, it does. So we talked about teenagers. One of the questions that's come up is at what age is too old to use medical play, would you say?
There's not really a cutoff because there are ways that you can adapt it. So, obviously, I think, there are some kids or, I think I played with dolls or Barbies, way into probably older than maybe kids now. So it really depends on your own child's level and what gets through to them. So if they're still playing with toys or animals or dolls or stuffed animals, that's usually when it works best.
Yeah. Okay, fantastic. Okay, this question has to do with interfacing with the child's doctor. So my child's doctor just wants to hurry up and get things done. How do I get them to understand that that may not be what's best for my child?
Right. And this is a common challenge. And I do believe that most practitioners go into healthcare with a desire to help families and help children and support children. And there are a lot of pressures for how that role especially exists now. So some of it really is awareness. And they are definitely a lot better. We go to a couple different children's hospitals, and just the changes I've seen in the last 10 years have been amazing and really good to see. But it might be good to set an appointment or send a message if you have a medical record system where you can send messages to say, can we have a chat about this? And, I just want to share some things about my child's experience and what my child's needs are and the expectations are. So some of this might involve some hard conversations. And we write about this in the book about what does it mean to be the leader of your child's medical team? And that's really what we are as parents or caregivers. It's a team, but we have to step into that role to be the leader, not to be the boss, but to really bring people together that specialize in all that particular areas. But what you specialize in is your child. And so really step into that role to say, this is what my child needs, and maybe focus on just one or two strategies initially, and going into that appointment or that visit, being really clear about what your child needs and how you want it to play out.
Absolutely. Absolutely. Okay, this one is about the feasibility of being able to go for a walk, for example. So single parents and with the shortage of nursing support, that for some families, just the 24/7 nature of care is a reality. And so how do I find those moments, right, to refuel? And I'm remembering in your presentation, and we talk about this quite a bit within Angel Aid as well, the five senses, sight, sound, taste, touch, and smell, and stealing back little micro moments of each day, maybe when coffee's being prepared, taking a few deep breaths, or putting on something visually empowering, like a Green Bay's or maybe a Celtics, jersey, or some sort of piece of jewelry or something that when you look in the mirror, you're reminded that you're an individual and you're supported. So any other kind of micro moment suggestions or other suggestions if truly you can't get away as a caregiver?
I think what's really key is to have a combination of routine and reward. So routines are comforting to our bodies, and they're just a part of our system that allows us to function in ways that in some ways go on autopilot. But I get up every morning and have the same cup of coffee, and it tells my body that, okay, we're ready to do this. So having those routines, identifying the routines that actually give you calm and pleasure and a sense of peace, and planning ahead, how can I fit, these 3 routine things into every day? And then, identifying maybe 3 reward things. And even if it's just, I'm going to put my headphones on and listen to one song, or I have a playlist that I love called Piano Chill that's on Apple Music. And it's just piano and it's so calming to my body, listening to 5 minutes of that. So identifying, like I said, maybe 3 routine items and 3 really short reward items are great suggestions.
Fantastic. Okay. Just a couple more minutes. So a couple more questions if you're open to it.
Sure.
Okay, great. There's tons, just so you know, we're not going to get to everybody's questions, but I think that is indicative of how rich this topic is and how meaningful and important it is that you've taken the time. So thank you again. How do you prepare your child for being taken back without you? Meaning taken into a room or taken back without you?
Yeah, that can be such a challenge. And it's usually unique to your particular child and what their challenges are and what their needs are. So there's a couple alternatives here. One is that you can look and explore the possibility of them not to be taken back alone, of you going with them. And so that involves talking to the medical team, and you might have to dress in a bunny suit, which is the full white gear. And I have lots of great pictures of me in those. So exploring that option, if that would make your child more calm, or where you can hold their hand while they put them to sleep with the mask or whatever anesthesia. So that's one option. Another option is, depending on their cognitive level of understanding, what would help them feel supported and calm to go back? Is it an iPad? Most places now will allow your child to take an iPad with them, their own from home, that you can preload and say, what are your favorite movie or stories? Well, we're going to save that one and you get that one when you go back with the special people, with the nurses. And again, it's kind of, I call it the happy cheerleader, where you make it sound really exciting. So, preloading something on, so you can download now from Netflix and everywhere else, and putting that on the iPad, or having that special toy that they get to hold and take it back there. Now you're going to show, Bob the Bunny how this all works, and make sure that the nurses say goodnight to Bob the Bunny at the same time they say goodnight to you. And, so some things, again, it's depending on what works for your child and whether you're going to go back or let them go back, but having some of those rewards that you plan ahead, that they, help you develop together.
Fantastic. Well, thank you. We've got a few sort of similar questions, which is, how do I help other families prepare, and where do I get your book? So I think you could probably answer that in the same fair swoop. I think Afraid of the Doctor.
Yes, you can. The book is available on Amazon, barnesandnoble.com. You can go to afraidofthedoctor.com and see more videos from us as the authors, and it has links to where you can get it. Bulk purchases are at Roman, ROWMAN, which is our .com, which is our publisher. And I think opening up the conversation and really starting to talk about this in our communities is going to be so important.
Melissa, thank you so much. We invite anyone on the audience to join our community. You can see at angelaidcares.org, just click join our community. Thank you very much for your time today. And
Yeah,
that's a wrap.
Great. Thank you, Crystal.
Thank you.